Hi, I'm Tomasina. I'm a researcher at the University of Plymouth.
I'm Hannah, also at the University of Plymouth.
I am Ilianna.
And I'm Kathy, and we're researchers at the University of Exeter.
We carry out research about dementia care, and we're part of a national network of dementia researchers called DEMCOM. And we were asked to share something about our research in a festival of events taking place in Dementia Action Week this year. We weren't sure what members of the public would like to know about.
So earlier this year, we visited people in various locations in the southwest to talk about the event. As a result, people with lived experience of dementia helped us develop our poster to advertise the event, an online form that people could pose questions to us, and this question box that we put in various locations so people could ask us questions. In this video, we're going to be answering a selection of those questions for you.
We found that many people wanted to talk about their experiences about dementia, and a lot of people had questions about their local services. We will make use of all the questions that arose and plan to discuss this with our colleagues to see if there is a need for better provision of information.
We collected more questions than we were able to answer in the video, so we're going to focus on questions about care research, although we were asked a lot of questions on other aspects of dementia research. So as an introduction, we'll briefly address some of the general questions, as a lot of people asked us about the causes of dementia, the diagnosis, and about medications.
Dementia questions. One of them is, are more people getting dementia than in the past? The number of people living with dementia is increasing worldwide. This is largely due to population growth and aging. Since dementia primarily affects older adults, the rising number of older individuals means more cases overall. However, it's worth noting that while the total number of dementia cases is rising, some studies suggest that the rate of new cases may be declining in some regions, including Europe and the US. This could be due to healthier lifestyles and better treatments for conditions like high blood pressure and high cholesterol, which also impact brain health. So while dementia is becoming more common globally, efforts to reduce risk factors such as improving education, improving the management of chronic conditions, and promoting healthy habits, all this could help slow its growth. The question we received was, how hereditary is dementia? Dementia is not always hereditary, but genetics can play a role in certain cases. Most types of dementia, including Alzheimer's disease, are not directly inherited, meaning having a parent or a grandparent with dementia does not guarantee you will develop it. However, there are rare genetic mutations that can cause inherited forms of dementia, especially young onset Alzheimer's, which develops before the age of 65. But these cases make up less than 1% of all Alzheimer's cases. Some types of dementia, like frontotemporal dementia or FTD, have a stronger genetic link. About 40% of people with FTD have a close relative with dementia. On the other hand, vascular dementia is not usually inherited, but the health conditions that contribute to it, like high blood pressure or diabetes, these conditions can run in families. Another common question is around risk factors for dementia. So let's see what are the genetic and environmental risk factors. Genetic factors can play a role in dementia risk, but most cases are not directly inherited. Some key genetic influences are ApoE, the apolipoprotein E4 variant, is strongly associated with a higher risk of Alzheimer's disease. Another one is rare genetic mutations, some forms of young onset Alzheimer's, which develops before the age of 65, and frontotemporal dementia, or FTD, are caused by inherited mutations. Also, a rare form of familial Alzheimer's disease caused by mutations on the amyloid precursor protein or the presenilin genes. But even if dementia runs in your family, lifestyle choices can help lower your risk. Nearly half of dementia cases could be prevented or delayed by addressing certain modifiable risk factors. That is a very large percentage and is good news. A major study led by UCL researchers identified 14 key risk factors that contribute to dementia risk. So let's see some of them. These are early life risk factors, which include lower levels of education, which can increase dementia risk. There are several midlife risk factors linked to dementia, including hearing loss, high cholesterol, LDL cholesterol, depression, traumatic brain injury, physical inactivity, diabetes, smoking, high blood pressure, obesity, and excessive alcohol consumption. And then later life, factors such as air pollution, social isolation, and untreated vision loss also contribute to dementia risk. What can we do with this information? Well, research suggests prevention efforts should start early, and by addressing these risk factors throughout life, individuals and policymakers can significantly reduce dementia cases worldwide.